Hello guys and welcome back to my channel. Today we're tackling an incredibly important topic and it is about infertility. So I will be explaining to you the various signs which you could see that can suggest that you might be infertile. So if you're a woman watching me, watch out for these signs, and if you think that you're also experiencing infertility, it is time for you to go see a healthcare provider. So let's find out what these signs are. But just before I talk about these signs, let me quickly explain what infertility means. Now, according to the World Health Organization, they describe infertility to be the inability of a woman to get pregnant after consistently trying to get pregnant for one full year. However, this time frame shortens to 6 months for women who are greater than 35 years. So this means if you are over 35 years as a woman and you've tried to get pregnant for more than 6 months or up to 6 months, it is time for you to seek the help of a healthcare professional. You don't have to wait up till 1 year. And also, it's very important to know that infertility can affect women of all ages, both younger women or older women. Now, having come to know all of this, is important for you to know the possible signs that could indicate that you are having fertility issues. So, let me talk about these signs. So the very first sign is irregular period. So if your periods are very irregular, often very late, or vary significantly in length, it could be a problem with your hormones. And that means you have to really keep an eye on your period. You have to monitor it, know your cycle length, and with that, you'll be able to actually know when there is problems with your period. So in this case, the use of various apps that can really help you to track your period is very important. Apps like the Flow app, or even the Clue app. These apps are really very helpful in helping you to track your period, and with that, you'll be able to find out if you're having irregular periods or not. The second sign is having dysmenorrhea. Dysmenorrhea simply means very painful periods. So if you have extremely painful periods, what this means is that they are so painful that they interfere with your activities of daily living. You can't go to school, you can't go to work, some people can't even get out of bed. This could be a sign that you're having other conditions like endometriosis or fibroids. These conditions can really impact on your fertility and make it difficult for you to get pregnant. So if you're having dysmenorrhea, it's worth bringing it up to your healthcare provider, as they could, do some necessary investigations to find out what could be causing it, and probably it could be the reason why you're not able to get pregnant. So let's talk about the third point. The third sign is unexplained weight changes. So whether it is a sudden weight gain or loss, it is very important to take note of these things, because hormonal changes can be associated with conditions like PCOS. So these hormonal imbalances can really affect your fertility. So it is very important to pay good attention to your body. Noticing these sudden weight changes, be it a sudden weight gain or loss, is something worth mentioning to your healthcare provider. And if it's something that they feel is affecting your fertility, then it can be easily treated, probably by lifestyle modifications like exercise, changing your diet, and other things that might help to maintain a healthy weight. These are the things that you should always pay attention to, because they really affect a lot of women when it comes to infertility. Another common sign is changes in your vaginal discharge. Now, when there are changes in your vaginal discharge, you find out that it's now having some kind of bad odor, having some kind of color. And then in this case, it is very important that you get it checked, because this could be as a result of some kind of infection, especially sexually transmitted infections, because some of these sexually transmitted infections can really cause infertility in the long run. So it's very important that when you experience these vaginal discharge changes, that you get it checked and treated as soon as possible, because it can lead to serious complications which lead to infertility. The next point is skin and hair changes. So if you're experiencing something like increased acne, increased hair growth, especially in parts of the body that a woman is not necessarily expected to have hair, like having hairs around your beards or having it around your chest area, in other parts of your body that you're not supposed to have hair as a woman. So it could be a sign of some hormonal problems. Also, having increased hair loss. So when you experience these signs, these are signs that could indicate that there are hormonal problems within you that are impacting your fertility. It doesn't necessarily mean that having one of these signs means that you are, having infertility problems. Some women have these signs, but normally they are okay. So I'm just giving you the signs to look out for, which your healthcare provider will also look out for when they are trying to find out the cause of infertility. So the next sign, which is the sixth sign, is having some specific disease conditions. So disease conditions like diabetes, thyroid problems, or autoimmune disorders. These kind of problems can really affect your fertility. So if you're experiencing any of these at the moment, it is very important to keep them under control. Make sure you manage them properly, consult your healthcare provider, and make sure you're taking your medications as prescribed. Keeping them under control can really help you to still achieve your goal of, getting pregnant, even with these conditions. So, in conclusion, what I'm saying is that these are the possible signs which can actually affect your fertility. If you're experiencing any of these signs and you're trying to conceive at the moment and you're not able to conceive, it is worth mentioning it to your healthcare provider, as they might want to do the necessary investigations to find out if they are the actual cause of infertility, or probably something else could be causing it. There are many other things that could be the signs you're having, which you may not really know. But when you go to a healthcare provider, through questioning, they will be able to identify these signs. So that will be all for this video. If you found it helpful, please do not forget to give me a like and subscribe to my channel, as this is really important to me. Thank you for watching, and I'll see you in my next video. Bye for now.